I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And as I regularly do, I'd like to have a good conversation with you. And let me thank you in advance for listening, for paying attention, and I would really love if you shared all this information with people that you love. Because I do this out of my heart, and I do it because I love you, exactly because of the same reason. And I try to give information to people about disease, and also about being healthy. Because after all, remember that health brings wellness, and wellness brings joy. So there's not going to be a joyful life if we are not healthy. And past this epidemic, I think it became very clear to all of us that health is probably one of the more treasured things that we can have. That's what makes us function and make money and be triumphant and share and have joy, etc. Without health, nothing is really possible. If you're going to be in a room, if you're going to be with medication, if you're not going to feel well, if you're dizzy, if you're nauseated, if you cannot eat, etc., all that is going to ruin your day and certainly your ability to do the things you love, including making a living. And we all have to make a living and we'll want to have a joyful life because we want to share it with people that we love. And that's what I love to talk about because I'm a doctor. I go to the hospital every day and I see patients, and I have said this a million times, people that I wish I would have seen before because I know there is a better way than getting to be sick and getting to have a treatment, as successful as it can be. And I'm going to refer today about something where success has been important. I'm going to talk about heart disease, vascular disease. Why? Because it is the number one cause of death in America. More people die of heart and vascular disease than any other disease, including cancer. So this should bring it to the first row, to bring it to our full attention. If whatever happens, the more chances I have to die of is of heart disease or vascular disease, the stroke or gangrene or anything like that. I better pay attention. This has to be important, and it is very important. And yes, the medical world has given a lot of attention to this area, a lot of attention. So much that the good news is that death rate and mortality, overall mortality for heart disease has been coming down in the last probably 30, 40 years. So yes, we're doing well. We're controlling a lot of the problems. We have almost miraculous procedures that can save your life if you act on time. So there are a lot of things that have progressed the way we wish they would progress. And all of you have been close to a heart and vascular hospital, and you know that the armamentarium, the gadgets, the knowledge, the everything they have is really astounding. And yes, we're doing a lot of progress in that area, thank God. Mortality, if you have to have a heart attack or anything like that, the chances of you dying today are much less than when they were just 10, 20 years ago. So we're doing well in that area. However, and this is where I see it every day with just about every chronic degenerative disease. We're looking for ways to deal and treat an illness that should not have happened in the first place. And that's where I want to bring the attention to. That's why I chose that subject. In some of the recent shows, we have talked about metabolic syndrome, we have talked about diabetes, we have talked about inflammation, and all those things, and they are all interconnected. Absolutely all of them are interconnected. We have probably about half of the American population overweight or obese, close to that diabetic or pre-diabetic, and all those circumstances make you a good candidate to have heart or vascular disease. And yes, I'm telling you, if you happen to have heart and vascular disease, your chances of survival are better than ever. However, why do you have to go to a heart hospital? Why do you have to spend time doing those things? Why do you have to have a stent? Why do you have to have any of this if you could have prevented the whole problem to begin with? And that's what I want to bring your attention. If we do not educate ourselves, if we do not educate our children, if we don't educate our peers and friends, this is going to continue on and on. And I don't hear the message anywhere saying, don't get sick. Yes, I can do a lot of things now that I couldn't do before, but my first piece of advice is do not get sick in the first place. So, I'm going to tell you a little bit of where all these heart problems come from. And as I go, I'm sure you're going to understand that I can manage that, I can change that, I can certainly intervene in this. And by doing that, I might be able to stay away from that disease altogether. Many people say, for example, Doctor, heart disease is in my family. My father died of a heart attack. My grandfather died of a heart attack. One of my father's brothers, my uncle, died of a heart attack. So it's in my genes. Well, you know it. Are you doing anything about it? When we talk about genetic predisposition, we tend to be very fatalistic. Like, okay, this is going to happen. This is printed in stone. There's no way you can change it. And think again. Remember that genes are only an instruction that's given to a cell to do something. But that instruction can happen or not happen. Genetics say can be expressed or not expressed. And certainly, there's something called epigenetics, which is everything that happens around those cells that can change the way your cells are going to behave. Your genes are going to be either being able to be expressed or not being expressed. So you have options. Even if it's in your genes, you have options. And that is my message today, that we don't have to go through the problems of disease when we know we can make a lot of changes in our lifestyle and just be healthier and just be with a lot of wellness and joy. That's the bottom line. So let's think of this. Let's think that yes, you have some genes that predispose you to have a heart attack. But on the top of that, you're gaining weight, your blood pressure is going up. Because of that, your kidney condition is not what it should be. And then we eat a lot, we are overweight, we have a fat content in the blood beyond what it should be, so the blood doesn't flow as it should, and those things accumulate. And like cigarette smoking is going to be directly affecting the inflammation of the inner part of the blood vessel. So think of this for 1 second. If you have a pipeline and the lining inside gets thicker, the caliber, the functional caliber of your blood vessel is going to diminish, and that's going to slow the passage of blood. And the slower the blood flows, the more chances it has to clot. And if a clot develops, then you don't have a circulatory impairment. You have a whole blockage. And from that point and beyond, there's going to be a very poor supply of blood, if not nothing of blood supply beyond that point. And that means no oxygen, no proteins, no healing things, nothing. And at the same time, waste, carbon dioxide, and everything is going to accumulate because the blood is not going through and bring it out. What's going to happen? Well, we've seen it through the history of mankind. What happens if you get an area, a town, and you block it from the outside world? No water, no food supply, no nothing. You just leave them there, isolated. You know what's going to happen? They're going to perish. And that's the way they handle a lot of problems, like in the Middle Ages. We have seen movies about it. Well, the same happens with the tissue from the obstruction and beyond. That tissue is going to die. And when it happens in the heart, the area of the heart that's going to be dying, we're going to call it an infarction. And that infarction means that heart is dead, that part of the heart is dead, that heart cannot contract, that heart cannot push blood, that heart cannot do the functions that it should be doing. And that's the end of the story. So yes, modern cardiology can do still at that point wonderful things for you. But who told you to get obese, smoking, and do everything wrong if you knew in the first place that you were prone to develop this disease? I can tell you so much more, so I want you to stay with me and follow me. You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today, we're talking about heart and vascular disease. #1 killer in America. So it should be important. It should really catch our attention. If out of everything else, my chances of dying are a lot bigger of heart and vascular disease, that should really catch my attention. And on one hand, we're saying that medical progress has helped us to decrease mortality of these causes, heart and vascular disease. We're much better than where we were, let's say, 20 years ago. Our chances of dying of a heart attack are much less today than what they used to be. And that's thanks to a number of progress and discoveries and creation of armamentum and radiological things and procedures that were only a dream just very few decades ago. But today they're possible, and they're successful. And my big question is, if we are so successful in dealing with heart and vascular disease, how come continues to be the largest cause of death in America? Because the numbers are staggering. Yes, you can have the perfect treatment for this problem, But you have so many people being affected that you're just making a small dent on the whole figure. And not everybody has the opportunity to go to one of these large cardiological centers. And not everybody gets on time, which is the other part of the equation. You really have to be lucky. I have a good friend of mine who had one of these heart episodes just a couple of months ago. And let me tell you, he was on an ambulance helping a friend being transferred to a hospital. You couldn't choose a better place to have a heart episode. So what the ambulance did is just turn around, go to the cardiological center, they put him in the emergency room, they put him in the OR, and he was being treated 20 minutes later. How lucky can you be? And yes, he came out of it with flying colors. He did very well. But what if he had been at home? And I say in his particular case, because he lives up in the mountain. He loves to have kind of an isolated lifestyle. And he lives up in the mountain, and roads are not good, and his car is not that great, and he couldn't have driven anyway. Not under the conditions that he was. So I go back to my primary question that I have for everything that concerns chronic, inflammatory, degenerative disease. Why do we have to get sick in the first place? Don't tell me how successful it is. Don't tell me that cancer therapies have advanced. Don't tell me that heart has done wonderful things in terms of procedures and treatments. And the numbers of mortality once you have a heart episode are going down. But why do I have to be there in the first place if I know that I could avoid it? And that's exactly why the dire importance of this message, that we have everything in our hands, everything within reach to change all that for the better. And we know, you know, and I know that there are a lot of things that we can do to be healthier. And all we have to do is bring them into perspective. Many of us were brought up in the after-war years, after 1950. And in those years, we thought that living it up, eating a lot, having packed food, and smoking and drinking and everything was what we all were entitled to. It was a sense of entitlement. Well, we have fought, we have gone a long way, I deserve this. And then disease started to progress. Let me tell you a number that I just read about yesterday. Allergies grow from 3 to 9% every year in the Western world. It doesn't happen in Central Africa, it doesn't happen in the Pacific Islands, but yes, in the Western world, particularly in the USA. Obviously, we're doing things that we should not be doing. And I always ask that question. If we have a breast cancer number which is very high, and there's a country that has very low breast cancer, why don't we just check out what they do that we don't do, or what we do that they do not do? Simple. Well, they're very careful with this. This is the way they eat. This is the way they live. Well, this is the way we do it. Why don't we check if we can make changes to be healthier? And don't tell me that, how do I know? Well, it's very simple. If I open the Bible, which to me is the first health book ever published, and you read Leviticus or you read the Genesis, it talks about what we should be eating and what we should be doing. Simple as that. So it's a matter of obedience. We don't do it. Okay. What can we change? What is easy for us to change? To me, the easiest one is very simple. Stop smoking. Smoking is one of the major factors of heart and vascular disease. If we were to stop smoking today, I think the whole world will see a big benefit with much lower numbers of cancer, of heart, of vascular disease, just by stop smoking. If we started eating right, oh my God, I would think that half of the diseases that we see today would just disappear, because we were created in perfection. And as perfect as we are, we have done everything possible to ruin God's work. We indulge in things we shouldn't, we overeat, we eat very frequently, we eat the wrong foods, we do not exercise, we have very little physical activity, we are surrounded and assaulted literally by chemicals and stress and all these things. So no wonder this perfect body of ours is going to be in very bad shape in very short time. It's like having a brand new car. You don't take care of it, you're going to have it junk just a few years afterwards. You take good care of it, good. You're going to be in an auction for beautiful old cars. Well, let's keep our bodies in good shape, because this body of ours is what makes the money, is the one that works, is the one that brings joy and help to the family and looks after everybody else. And why not enjoy yourself in a very healthy manner? If we live in a world, because that's where we live, where about half the US population is either overweight or obese, and half of the population is either diabetic or pre-diabetic, and where a huge number of people have high blood pressure, what can we expect? We can expect a chain reaction, a domino effect of chronic inflammatory degenerative diseases. Remember that if we get inflammation of the lining of the blood vessels, our chances of reducing the caliber of the blood vessel is going to be very important. And as we do that, the flow of the blood is going to diminish, and the chances of developing a clot are going to increase. Very importantly. So that clot could stop passage of blood altogether. And before we get to that point, this inflammation is going to make the blood vessels hard, are going to make these blood vessels poor circulatory vessels, and we're going to start developing problems everywhere in the body. And a lot of the problems that we see today are developed because of poor circulatory, for poor blood flow conditions. If we reduce the flow of blood, remember, life is in the blood, we're going to reduce the amount of oxygen. Oxygen means energy. We reduce the amount of protein. That means growth. We reduce the amount of protein, healing proteins. That means recovery and restoration. So we're going to enter a situation in which everything is going to be affected. You do not want to be there. You don't have to be there, because we can change it all for the better. So if you stay with me, if you follow me not only in this program, if you follow me with other blogs, with other information, you might be able to get a different perspective of things. But the most important part is that I am your friend, and I hope you follow me, and I hope you ask a question. I hope I can guide you to replan your whole life strategy and the life strategy of everybody that lives with you or around you, peers, friends. Because we have to educate ourselves. The more we know, the more we can prevent. The better we're going to perform, and the more joyful life that we're going to have. So stay with me. I still have a very important part of message to share with you. I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And like every so often, I like to share some information with you about health and disease, health management, prevention, and things you can do not to become a patient. I'm a doctor, and I see people, sick people every day. And in today's environment, the type of disease that we see the most are the chronic, the inflammatory, the degenerative diseases that we self-produce, that we self-inflict. So every time I'm at a hospital and I'm looking at a lot of people, I say, why didn't he do anything? Why didn't he act on time? Why didn't he prevent this problem from happening? And even in the best of the cases, even if you're successful with the treatment, well, you didn't have to be there in the first place. And it happens because of two things. One, well, ignorance. Many of us do not know how to treat our bodies. A good friend of mine always said, the problem with humans is we were never given owner's manual. Nobody tells us how to unpack, how to put together, how to run, how to clean, how to maintain our body. We just play it by ear. And normally that playing by ear means we do whatever our parents taught us. And that's it. Other times, bad influence. Somebody that makes you smoke or take drugs or get drinking. But nevertheless, it's still within our reach to make the changes. So it is ignorance. We don't know that if we do certain things, we are going to pay a very high price. And we do not understand that if we take care of ourselves, that we are going to have a long, joyful, productive life. And I see it all together, all the time. People saying, you know what, I don't care, because after all, if I get sick, I'm going to go to the doctor, and my doctor will give you a prescription, and I go to the pharmacy, I take the product, and I'm fine. That's not the way to do it. Because number one, a lot of diseases are incurable. That's today's environment. If you have diabetes, if you have heart disease, if you have Alzheimer's, if you have a lot of problems, high blood pressure, you can go to the doctor and say, doctor, I'm going to take this medication. Fine, I understand it. I have this problem. This is my recipe. This is what I'm going to take. How long I'm going to take it for? And the doctor is going to tell you for the rest of your life. What means that? It means that whatever the doctor has prescribed you for is never going to heal 100%. We have a word today in medicine that solves the problem. You have a disease that we're not going to cure, but we can control it. Which means you're going to have to go to regular visits every so often to the doctor, that you're going to have regular visits every so often to the laboratory, you're going to have imaging procedures every so often, and you're going to be going to the pharmacy very frequently. And all that is going to be paid with hard-earned money that should be going somewhere else. Should be going to your vacation, should be going to your retirement, should be going to a lot of things. But no, we have to spend it in medical care of a problem that we didn't have to have. Heart and vascular disease are based on three functions to make the blood flow. Remember again, life is in the blood. The secret of life is the movement of blood. You know, in the Middle Ages, there was an Italian anatomist and researcher whose major discovery was that the blood flows. Of course, we knew there was blood in the body. I mean, if you're with a gladiator, if you are in a war, if somebody falls off a cliff, you're going to see blood spilled, which means people had blood that we have known all the time. Well, this Italian researcher, discovered that not only we have blood in our system, but the blood flows. And the second important discovery was, from the blood movement depends life. If the blood stops flowing, you are going to die. Of course, we all understand that today. We all know it today. We have blood, and the blood has to flow. And we know that it is because of everything it delivers to the tissues and everything it picks up and brings back to be discarded. Carbon dioxide in the lungs, urea in the urine, etc. But if the blood stops flowing, we're history, we're gone. So yes, life is in the blood, but it's in the flowing blood. You just don't have to have blood, it has to flow. And it flows thanks to three big elements. One is a pump. We have a pump that keeps the blood flowing. That's our heart. We have a huge number of pipes, which is the vascular system, that brings to every single cell, to every single corner of the body, delivers the blood, or brings it back to the heart to be pumped again. This is a closed circuit. And third, that very few people are aware of, but it's very important, it depends on the thickness, of the density of the flow of the blood, of the fluid you're transporting. It is very different if you want to run water through a pipe than if you want to run oil. The thicker, the harder it's going to be to move it around. So those the three things we have to take care of. The pump, our heart, the health of our vascular tree. We have to make sure there is no inflammation. We have to make sure there is no damage. We have to make sure our blood vessels are built with quality material. And third, we have to make sure that whatever we do, we don't make our blood thicker, because that can create a problem in itself. And let me tell you something which is very important. The heart very rarely gets sick. The heart is a very resilient organ. It's very difficult that you have a heart disease in itself. In other words, that the heart is affected, like in a myocarditis, which are not very frequent. What we see every day when you say he had a heart attack, he had a heart problem, it's a vascular problem of the heart. In other words, the blood vessels that supply energy and everything to the heart are blocked or damaged. And that diminishes the blood supply to the heart. And we said it already, if we get to block the flow to some part of the heart, the muscle from that point and beyond is going to die. That is a heart infarction. And if the infarction is big enough that the function of the heart is impaired, you die. If it's small enough, you might be able to make it with whatever portion of the heart is still working. But again, when we damage our heart, most of the cases is not the heart, but the blood vessels that supply the muscle, which is the heart. So the health of our blood vessels is very important. And the best way to damage it is by cigarette smoking. And the second, with sugar. Because sugar creates inflammation of the blood vessels. And when we get inflammation of the blood vessels, then we reduce the caliber of the blood vessel. That reduces the speed of flow. And remember that we have platelets. If anything bumps into a swollen lining, it can create a clot because we break platelets. And that brings about coagulation, and then you get a clot. And once we get a clot, there's going to be a problem. It could happen in a hand, it could happen anywhere. No big deal. But what if it happens in the heart? You have a heart infection. What if it happens in your brain? You have a stroke. And when we diminish the circulation of certain areas of the body, which are very sensitive, then you can produce big problems. Like in diabetics, where the blood becomes thick because of the sugar level, because of the diabetes and metabolic disturbance itself. Then what's going to happen is the flow to the retina, which is very sensitive to any lack of oxygen or nutrients, then the retina is going to get hurt. That's why a complication in diabetes could be blindness. And also, in the distant part of the body, we can have problems because that blood flows against gravity when coming back. And then you have swollen ankles, and then you have ulcers, and you can develop gangrene and have an amputation of your legs. So make no mistake, having a vascular disease can bring a lot of pain and suffering. And we can help it. We can block it. We can prevent it altogether. That's the important message. How? By educating ourselves, learning. We have so many resources today, just within your reach, just on your cell phone, that you have to learn. You must learn about it in order to start changing your lifestyle and work for a change for the well-being of your body. I'll be just one more segment with you. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I sincerely hope that you not only listen to this broadcast, but you share it. I sincerely hope that you follow me in the social media of your choice. But I hope that we can become somehow associated, and you can ask questions, and you can make comments, and I can hopefully guide you to be healthier, to avoid disease altogether. Because if you listen to the whole segment, you're going to see that everything is possible. Everything is within our reach. We have been talking about the capacity of the heart to pump blood. We have talked about a lot of things like shared smoking and damaging. But you know, there are areas that I like to touch on. One of the areas that's important is salt. Salt is a very important substance to the body. Make no mistake, I'm not saying you should eat without salt, but we should be more careful about how we do it. And to me, the simplest piece of advice that I have seen is use sea salt instead of regular table salt. And the reason, I finally found a very well conducted research paper that tells me that sea salt has 15% less sodium than table salt. So if I change table salt for sea salt, all of a sudden, I got rid of 15% of my daily intake of sodium. Those are great news. To me, that's having my cake and eat it too. I can still have my salt, but much less sodium. Remember, the problem is not salt, it is sodium. Where else you have sodium? There's the enemy, in packed foods. Because sodium is a fantastic preserving substance. A lot of things, if you read the labels, you're going to see this and this and this as a preservative. And most of the time you're going to see the word sodium. I could tell you once and for all that packed foods should be away, completely away from your life. And we have other segments where we talk about chemical pollution, all the chemicals that we eat without knowing. And that comes in cans and tins and plastics and boxes and all these things. Because even if you have a box, they put a small little plastic lining to keep humidity out. So please follow me. I have a lot of information that's going to, I know it's going to be very good for you, very useful for you. So, if you reduce the amount of salt, you reduce the blood pressure. If you reduce the blood pressure, then you reduce the load to the heart. If you reduce the load to the heart, everything starts working better. Your heart becomes more efficient, the blood flow becomes more efficient, your kidneys become more efficient, and everything starts to work like clockwork, the way it should. But it is when we push things up and beyond when a lot of bad things happen. Why? Because we do, I don't know how to say it, and I have to confess myself, I was brought up believing that a lot of things that are not good were good. I mean, sugar was a big part of our lives. And every time you had any distress or problem, people would gratify you with sugar. Or give the kid a little bit of sugar, give the kid a candy, give the kid, even a pediatrician, you'd go to the pediatrician and the pediatrician gives the kids a candy. So sugar is all around us. That's been one of the big problems. And that also has affected a very important part of our metabolic context, which is the intestinal flora. You say, what has my gut have to do with my heart and my vascular system? Well, I found a very important connection that you know a little bit of common sense, of my mother told me, my grandfather told me. But where is the scientific connection? Because they tell you you shouldn't eat a lot of meats. You shouldn't eat a lot of huge amounts of animal protein. Well, the connection is that when we overeat protein, we change the content of our intestinal flora to a different type of bacteria that can produce substances that once they go into the circulation produce, guess what? Vascular inflammation. So it's not necessarily the simple thing of believing that when I eat a lot of fats and a lot of these products that they're going to kind of create a thick substance circulating in the blood. No, is that we produce inflammation of the blood vessel because abnormal substances being produced by the intestinal flora when it changes by an overwhelming amount of animal protein. And believe me, I'm very far from asking you to be a vegetarian. However, I have to tell you that research has shown that people that eat less meat tend to have less heart and vascular problems. You can eat meat, but let's be frugal. Let's be smarter. It makes no sense that a 16-ounce steak is not for human consumption. Not even 12. Dietitian tells us that a good amount is about 8 ounces of meat per serving. Never more than 8 ounces. And that's small filet mignon or small New York steak. Yep, you can have it. And you can enjoy it. And you're going to be happy with it. But don't overdo it. Don't overdo anything. One of the best nutritionists I have read is a British lady who says you should eat a little bit of everything and nothing in huge amounts. So have your little portions, enjoy them, have fun. You can have your little dessert, you can have your little meat, you can have your salads, you can have everything you want. Just be a little bit more frugal. We need a lot less food than what we believe. And if we're gaining weight, it says it all. You're eating too much. I remember a saying of Ivana Trump, the first wife of Donald, who said, you know you're eating right if when you wake up in the morning you're hungry for breakfast. And then when it comes lunchtime, you're hungry for lunch. And when it comes to dinner, you are hungry again. But real hunger. In other words, you say, oh my God, I'm hungry now. Because if you're not, you ate too much the meal before. And that's going to bring disease. If in the morning you're full because you had a huge dinner and drank and smoked, you're wrong. You have a problem. If by lunchtime you ate so much in the morning that you're not hungry, watch it. And at dinner time, the same thing. We have to be more frugal. We have to be more conservative. We have to keep, I said it a million times, we have to keep a caloric balance. If for any reason we're going to be quieter for 2-3 days because I have to stay in the office, I have this deadline to meet, etc., so I'm going to be in the office for long hours, eat less because you're sitting at your desk. And if you do that, you're going to be a lot better. I have also a segment that you could look for it if you follow our links on alcohol. Alcohol has a lot of problems. So drinking alcohol is one thing. Having a glass of red wine is a different thing. And there are many articles that say it might be even beneficial, particularly in the subject that we're covering now, which is heart disease. Because red wine might increase the bacteria in the gut that we need to block the bad bacteria that we were talking about. And by doing so, we're going to diminish these inflammatory substances in the vascular tree. Now, what I would say is, if you're going to have no more, I said 8 ounces of meat, I'm going to say 8 ounces of red wine maximum per day. And try to get a good quality red wine, and by that I mean someone that has not been tainted with chemicals. In other words, that has naturally fermented. And then you have a very wonderful life with a lot of good benefits, and you're going to have your small steak, your glass of wine, your big salad, no sugar, a cup of coffee. By the way, more and more I go, the more and more I see that coffee is not a problem with heart and vascular disease. Particularly if you are not hypertensive, coffee might even be a benefit. If you are hypertensive, this is high blood pressure, then you have to be careful with coffee. But if not, it might even be protective. So let's learn, let's educate ourselves. And when in doubt, why don't you call me? Why don't you click on BioCare? Why don't you take a 10-day BioCare health getaway? Why don't you jump on an airplane and say, I'm going to spend 10 days, 2 weeks, in a cruise at BioCare. And I'm going to learn and change the way I live. And I'm going to ask for recipes or cook with the people at the hospital and learn to make some bread and learn to cook from scratch and buy my own groceries, my own produce, because I want to be healthy and I want to do that for my family. And I will share all that with my peers, with my friends, with the people I love. Why don't I teach them how to do things? And next time I want to visit a hospital, I'm going to go to BioCare, because that's the place where I'm going to be understood, I'm going to have friends, and I'm going to enjoy. Click or call BioCare. I'll be waiting for your call every day, all the time.